Medulloblastoma is a common type of primary brain cancer in children. It originates in the part of the brain that is towards the back and the bottom, on the floor of the skull in the cerebellum or posterior fossa. The brain is divided into two main parts, the larger cerebrum on top and the smaller cerebellum below towards the back. They are separated by a membrane called the tentorium. Tumors that originate in the cerebellum or the surrounding region below the tentorium are therefore called infratentorial. Medulloblastomas are invasive, rapidly growing tumors that, unlike most brain tumors, spread through the cerebrospinal fluid and frequently metastasize to different locations along the surface of the brain and spinal cord. Medulloblastomas metastasize all the way down to the cauda equina at the base of the spinal cord, and this is termed drop metastasis. The cumulative relative survival rate for all age groups in histology follow-up was 60%, 52%, and 47% at 5 years, 10 years, and 20 years respectively, with children doing better than adults. A 5-year-old boy is brought to the pediatrician by his mother for a follow-up appointment. 2 months ago, the boy was seen for a chief complaint of morning headaches, vomiting, and decreased energy. A gastrointestinal illness was suspected. At this visit, the mother reports that her son's symptoms have worsened and that he now is falling and has a stumbling gait. What is the likely diagnosis? The history suggests medulloblastoma, a highly malignant tumor most often found in the cerebellum. The majority of patients are 4 to 8 years of age, and males are affected more than females. In children, 70% of intracranial tumors are infratentorial, whereas in adults, 70% are supratentorial. Although medulloblastoma is the most common pediatric brain tumor, astrocytomas, brainstem gliomas, and ependymomas are also common. Astrocytoma begins in cells called astrocytes that support nerve cells. Astrocytomas can occur anywhere in the hemispheres or in the brainstem. Ependymoma originates from ependymal cells, which line the fluid-filled spaces, ventricles, in the brain and spinal cord. In children, ependymomas typically occur in the fourth ventricle and are characterized by perivascular pseudo-rosettes, in which cells are arranged around long, delicate processes directed toward the vessel wall. While in adults, ependymomas are often seen in the spinal cord. How do the cerebellar lesions present? Cerebellar lesions can occur in either the vermis or the hemispheres. Lesions in the hemispheres cause ipsilateral limb ataxia, intention tremor, and loss of muscle tone. Limb ataxia refers to a lack of muscle coordination in the arms and legs, leading to clumsy movements and difficulties with tasks requiring fine motor skills. Intention tremor is a type of involuntary shaking that occurs when a person attempts to make a voluntary movement, especially when reaching for a target. Superior vermis lesions are characteristic of Wernicke encephalopathy and alcoholic cerebellar degeneration. Wernicke encephalopathy presents with the classic triad of gait or truncal ataxia, ophthalmoplegia, and confusion. Gait ataxia is characterized by a lack of muscle coordination, resulting in a wide-based, staggering, and unsteady gait. Ophthalmoplegia refers to the paralysis or weakness of muscles that control eye movement. What imaging technique is used to visualize medulloblastomas? On MRI of the head, medulloblastomas are heterogeneous enhancements located in the cerebellum, often extending into the fourth ventricle. Medulloblastomas may present with what other syndrome? The association of inherited colonic syndromes with brain tumors is named Turcot syndrome. Patients with autosomal dominant familial adenomatous polyposis are at risk for medulloblastomas and gliomas. Patients with hereditary non-polyposis colorectal cancer are at risk for gliomas only. What is the morphologic appearance of medulloblastomas? Medulloblastomas are rapidly growing, well-circumscribed, friable tumors found exclusively in the cerebellum, more frequently in the midline adjacent to the roof of the fourth ventricle. Microscopically, Horner-Wright rosettes, described as circular patterns of tumor cells surrounding a center of neuropil, can be seen. Neuropil is any area in the nervous system composed of mostly unmyelinated axons, dendrites, and glial cell processes that forms a synaptically dense region containing a relatively low number of cell bodies. What is the treatment for medulloblastomas? Treatment consists of complete or near-complete surgical excision, followed by radiation and chemotherapy. Current treatment protocols are designed to minimize damage to adjacent structures and prolong survival.